KFWB News Talk 980. This is Dr. Chambers on call, keeping you healthy without the dreaded copay. 888-539-2980 is the number to call with whatever is on your mind about your health. 888-539-2980. Obamacare launched this week. That's the Affordable Care Act. The covered California opened up October 1. It goes through March 31st, 2014. So if you want to buy a policy, you want to get a policy going for January 1st, 2014, you've got between now and March 31st. Everybody is obliged to get insurance under this plan. Everybody has to have insurance. Everybody. With only very small exceptions. So what happens if you don't? You got to pay a penalty. So next year, an uninsured adult will have to pay something like $95 is the penalty. But it rises. In 2015, it's going to be $325. And in 2016, guess what? It's going to be almost $700. So they're going to give you a little break. The first year, it's $95. And I believe personally that everybody has to have health insurance. Everybody should contribute. Everybody needs to pay in a little bit. And all this talk about young people subsidizing the old, that's the way insurance works. If you have employer-based insurance, that's what happens. If you're 20 in a company and the guy is 50 or 70, you're all paying the same rate. And guess what? The young guy is subsidizing the older person, and that's the way insurance always works. I'm going to jump over and take some calls. I'm going to talk to Emmanuel and Cerritos. Hi, Emmanuel. How are you?
How are you doing, doctor? Thank you for taking my call.
You're welcome.
Doc, I want to ask you about the Cialis and Viagra.
Yeah?
Well, somebody who is about, I'm 62 now.
Yeah?
And erection when you're having some fun.
Yeah? So let me just be clear here, Emmanuel. We're talking about Cialis and Viagra. These are these erectile dysfunction medicines that we give to patients who are having trouble getting an erection, getting hard.
Yes.
Go ahead.
Yes. Is there nothing else one can do to avoid taking that medication?
Well, let's be honest here. These are the best medicines that ever came. There's nothing better than those medicines. Now, we do have some things like pumps that can be put into the penis, and we do have some medicine that can be injected into it. But these are really simple. And Viagra, you can take it, and an hour or two later, it works, and you have your stuff. With Cialis, it's a longer little window. So you can take it in the morning, and it could work 12 hours later. That's its big advantage. But you know what? In all the years I've been doing this stuff, in all the years, decades now, I never saw a launch like Viagra, because people were just literally weeks beforehand were in anticipation. Talk about the new iPhone, forget about it. People were lining up in my practice wanting prescriptions for this, shaking my hand, saying, thank you, doctor, because it works. I think they may be a little bit overused now, but it definitely works. Let me squeeze in one more call. Chuck. Hi, Chuck. You're on with Dr. Chambers. How can I help?
Dr. Chambers, I had a scare where I thought that maybe I had some type of disease in my penis. I had this itch.
Mm-hmm.
And I went to the doctor. They couldn't find anything, but they treated me as if I might have chlamydia, and they called me back a week later. I did not. But I still have the symptoms where I have a tickle in the tube inside my penis going over to my anus. It's still there all the time.
Okay.
So what do you think it is?
Well, let me ask you a couple of quick questions before we get into that. You're how old, Chuck?
I'm 47.
47. Are you sexually active?
No, not at all.
When was your last partner? Within the last 60 days?
No, a couple of years.
Couple of years.
I'm with someone who went through menopause and is not interested in sex anymore. And I love her very much. I'm trying to be patient until she gets through that point,
Mm-hmm.
So once in a while, I take care of myself, if you know what I mean.
I understand. I absolutely do. So let's talk. There's a whole bunch of issues here, Chuck. The first thing is that if you haven't had a partner for 2 years, you don't have chlamydia. Or you don't have gonorrhea. So we can rule those out. Chlamydia and gonorrhea, they usually present with like a pain when you pee and a discharge from the penis, like a yellow or green stuff coming out. The things that I would worry about in a guy like you with your history is a little balanitis, which is a little inflammation at the cap of the penis, and that happens sometimes. Are you circumcised?
No, I'm not.
Yeah. So you know what you got to do is you got to pull the skin back all the way back, clean it out when you're having a shower, and then make sure the skin falls back in there. And sometimes a little fungus can get in there, to be honest, Chuck, and we have to give you a little bit of medication. I tend to use a one called diflucan, Diflucan. It's just one pill by mouth, and that goes away. That's one issue. The third issue is this painful at all, the little irritation?
It went away after I got treated for a little bit, but it's always there. And when I tried maybe after self-gratified myself, it hurts more when I ejaculate than when I pee. But after that, for a week after that,
I get you. I get it. So, what do you have a regular doctor?
Yes, I do.
Okay, I would go back to him and just get the routine stuff done, which is like a urinalysis. Let him look at the penis. Did the previous doctor examine you there?
Yes, they did.
He did, and he didn't see anything abnormal.
No, they saw no discharge, and they saw
Okay.
they couldn't see anything.
All right, and you have no history of herpetic lesions, of herpes?
No.
No. Okay, so I wouldn't be concerned about that. But you know what, Chuck, what's jumping out at me here is that there may be some stress in here. There might be some psychological issues because of your partner not wanting sex. So what I think you need to do is sit down with your partner and discuss this and say that this is adding stress into your world. You know what? And part of the problem when you're going through menopause for a woman is this. Her hormones are up and down, she's getting hot flashes, and she's getting a lot of vaginal dryness. That's one of the main symptoms of a woman going through menopause. And vaginal dryness is easy to overcome. All you have to do is go and buy some lubricants. Now, the old days lubricants, to be honest, were really bad. They were thick and awful and oily, and it really decreased the sensation and the enjoyment of intercourse. But that's not so anymore. They're a little bit pricey, but they're thin. They're as good as, almost as good as the real thing, as they say. So I'd encourage you to do that. But you've got to open up communication, because otherwise I feel, Chuck, that this is going to overtake your life a little bit, because it seems like it already has been doing that. And it's important. Oh, I'm sorry, what's important to understand, Chuck, is this. That when you have this problem, you go to your doctor, he looks at it, he does the test, he does all the stuff that needs to be done. Then once that happens, you got to move on from it. You got to start saying to yourself, why am I getting all of these symptoms? If there's no organic cause, could this be a lot of sexual stress that's building up in me? Could it be the stress of my relationship where there's no sexual contact? Because this is a very common problem, folks. I see this in my practice all the time. I see men who come in their 40s, and they say, like, my wife has gone off sex, she doesn't want to have sex, and what can I do about it? There's a withdrawal, the relationship falls down. And what you've got to do is you've got to keep communication open. That's the first thing. Ask your wife, ask your partner, whether she's your wife or not, what's going on, what can we do about this, how can we fix it? And then, bring your wife or your partner with you to the doctor, and you can talk through it. Now, sometimes, we docs nowadays, we're pretty busy. I get that. And not a lot of doctors have an interest in sexual health, which is unfortunate, because it's a big part of our life. It really is. And if you're not getting satisfaction when you go there, you might want to think and maybe go to a gynecologist, or go back to the practice and say, is there somebody who's interested in my sexual health, who's willing to sit down and talk to me? I'm almost in my final moments here. And you know what? It's 2 hours has gone by. It just flies by. I'm sorry if your calls didn't get through. You can email me during the week. My email address is drchambersoncall@gmail.com. That's drchambersoncall@gmail.com. I'm off from my own practice on Monday, and I will be answering emails, so get them in. The ones I haven't answered, I'll be catching up on. You can follow me during the week on Facebook. Don't forget to click like. Let me know that you're around. A lot of links to the stories that I talk about are on there. Some of the stuff that I like, some of the stuff I don't like. If you want to comment on the show, if you like the show, you don't like the show, if you want to suggest topics for the show, Facebook or email me. Comment. We'd like your input. We'd like to know what you're thinking, because what we're doing here is we're trying to keep you healthy without that stupid copay. There were a bunch of stuff that I didn't get to today because I ran out of time. One of them is sleep hygiene, and I put up a little link on my Facebook page, 12 simple tips to improve your sleep. They're very important. It's about caffeine, cutting it down, exercise and stuff like that. And I also put a link to a Harvard study where you can answer these questions, and it'll tell you if you have a sleep problem that needs further evaluation by a doctor. That's on my Facebook page, which is Facebook.com/Dr. Chambers on Call, Dr. Chambers on Call. My final quick thought here is about hormone replacement therapy. There's also a link on my Facebook page. Gotta run. See you next Saturday, where I'll be back keeping you healthy without the copay. This is Dr. Chambers on Call on KFWB News Talk 980.
The contents of Dr.